Hi, I'm Kristen Ochsner, a physician assistant at Skin and Beauty Center in Burbank, California. I'm going to talk a little bit about Tinea Versicolor. Tinea Versicolor is a very common skin rash. It's known as a fungal infection. Basically, it's a yeast that everybody has on their skin that in some people just decides to overgrow. Yeasts commonly grow in warm, humid environments. So it's seen in surfers when they wear wetsuits all day long and just trap that heat and moisture in against the skin. It's seen a lot in Florida. It's seen commonly here in Southern California and other tropical environments. The rash itself appears as small, hypopigmented or lighter spots, lighter than the normal skin color of the patient. In darker individuals, it can actually appear darker than their normal skin coloring. Sometimes it has a little bit of a scale to it. It can also appear a little bit pinkish occasionally. Some patients have itching associated with it. The way we diagnose it typically is just clinically we know that that's what it looks like. Sometimes though we have to do a skin scraping to look at it under a microscope and see the yeast, or we can also use what's called a Woods lamp that helps to fluoresce the yeast. It's typically pretty easy to treat. Sometimes you don't even need medications. Just a medicated over-the-counter shampoo like Selsun Blue or Head and Shoulders used for 10 minutes a treatment and then washed off 2 or 3 times a week generally will help with mild cases. If that does not help to resolve the condition, then you may need to see a dermatologist for a medicated cream or oral medications. But generally, just using the over-the-counter medicated shampoos will do the trick. And if you get this rash commonly, then you can just once a week use the medicated shampoos to help it from returning. Once the yeast itself clears, the hypopigmented or lighter spots can remain for several months before they repigment. So you just have to give it a little bit of time. If you have any questions at all about Tinea Versicolor or any other skin conditions, feel free to visit us at dermla.com or you can call us at 818-842-8000.